Type 1, type 2, type 2 I suppose. Anybody with type 1? No. Okay. 9 times out of 10 it's type 2 people have type 2. Type 1 is very rare. Okay, so good afternoon everybody. My name is Peter Theobald. I am a lifestyle advisor at an NGO called Sharan. Sharan is short for Sanctuary for Health and Reconnection with Nature. We have 3 different areas of working. One area is the area of health, one area is the area of environment, the third is the animal welfare. So I am more involved in the health part of it, so I don't get much involved in the animal welfare and other things. But they all interconnect, actually they all interconnected. Because what you do, what is good for your health, is also good for the animals, is also good for the environment. So it's actually all interlinked. That's why the NGO is formed by a lady, a doctor called Dr.Aniruddha, based out of Auroville. And she conducts full-day programs on all these topics. So, the full-day programs are held and then people, they're not willing to come and attend the full-day program straight away. So this is an introductory program to give you an idea of the whole thing. And then, you can decide whether it makes any sense for you to, do it. Okay. So this is a very short presentation actually. It's very easy. I can finish it in 2 seconds also. Can it be reversed? Yes. So you can all go, yes, it can be reversed. So that's a short of it. But if you want to get a little bit more detail, I will take about half an hour or so today explaining you the whole thing. It's extremely easy to do for me to speak it. Okay. The challenge is for you to follow it. So that's where the actual challenge is. Okay. So, but let's go a little bit into detail because I don't know the knowledge level of everybody. So we want to give a little bit of background on the whole problem, okay. And then how it is to be handled and how it is handled. So what is diabetes? This is a dictionary definition. So the key thing I want to point out is the word lifelong. Okay. So you go to any traditional, conventional doctor, most of them at least very recently, they'll say if you have diabetes, that's it. Cannot be cured. We have no medicine for it. Cannot be reversed. It can be managed, controlled. You have to take care of your diet. You do exercise. You have to take your medicine. This, that. And you have to live with it for the rest of your life, and you have to be careful. This is a tradition. And this is actually the dictionary. If you go to Google and do a search on any government website, medical website, this is what you come up with. So it's a lifelong chronic disease which are high levels of sugar in the blood. Now, always what we say at Sharan and many people in this field always say, we have to look at the cause. Why is there a high level of sugar, glucose in the blood? Why? And instead of trying to reduce the level of sugar in the blood or do something else, we need to find out why that level has gone up in the first place and what we can do to restore that to normal. If we restore that to normal, the problems kind of go away. So that's what this whole thing is all about. That's how we are going to reverse diabetes. We are going to reverse diabetes by finding out the cause of diabetes and addressing the cause. And then the problem goes away on its own. It's not that Dr. Aniruddha or me or anybody else cures you. We are not curing you. We are not giving you any medicine, any supplement, any plant, any powder, any injection, any magnet, any acupressure band, nothing. We are not giving anything to you. We are just giving you the knowledge, the information, which you can use. And how you use it, you follow it. Once you follow it, the cause is addressed. The problem goes away. Simple thing I can tell you about, if you have a bathroom, a leaky tap in the bathroom, valve is broken, and it's flooding the water. And the bathroom is getting flooded and wet. And you're taking a mop and you're trying to clean it up, and you're swapping it, and you're putting some pipe outside, and you're doing all kinds of things to try to get the bathroom dry. Okay, but you are not addressing the problem of the tap which is leaking. It's as simple as that. So most of the conventional approaches are swapping the floor or putting a drainage pipe extra. They're not trying to see this tap is leaking, this tap valve is broken, I need to fix this, I need to stop the water from gushing out in the first place. That's what we're going to work on in this presentation. Okay, so what are the symptoms of diabetes? I mean, if you go to any doctor or many of you have diabetes, you see all these symptoms. The most common ones are increased thirst, the need to urinate frequently, feeling tired, and unexpected weight loss. These are the most. In fact, when somebody he doesn't know he or she doesn't know they have diabetes, but they have these symptoms: the increased thirst, the need to urinate, feeling tired, feeling ill, not feeling up to the mark, and unexpected weight loss. This is when they go to the doctor, then they get a blood test done, and then they figure out, oh, this is a problem. So we need to understand, why these symptoms? Why does a diabetic feel tired? Why does he feel thirsty? Why does he urinate often? Huh? Why does this thing happen? So, okay, so the basic thing is what is happening is, it's a very funny thing. All of us are eating food of different kinds. It gets digested in our bodies, and finally it gets broken down into the simplest molecule possible, so glucose. So glucose is what is needed by each and every cell in our body for energy, for the process of metabolism. So the job of the blood is to carry the glucose to each and every cell. Okay? Now for some reason, this glucose is not getting from the blood into the cell. It is getting stuck in the blood. That's why you have a higher level of glucose in the blood. Now, what is happening to the cell? The cell is not getting the energy, the fuel. It's not getting the fuel. So it is literally starving. Energy is not there. That's why you feel fatigue. That's why you feel not 100% energetic, not up to the mark. Now, further thing what happens is, because now there is a lot of sugar in the blood, it's going above the normal level. The body wants to get rid of it. So, in the urine, the sugar is passed out. Now, when the sugar is passed out in the urine, it carries out water along with it. So, first of all, sugar is passed in the urine out. So, then if you do a urine test, you will find glucose in the urine. Now, when the glucose is going out in the urine, it carries along with it a lot of water. So, you feel thirsty. And because there is more and more glucose the body is trying to get rid of, you have the need to urinate more and more often. You feel thirsty, you feel fatigue. And now, finally, because the fuel is not getting into the cell, you are actually, your cells are starving and you end up losing weight also. So these are all then afterwards all the other complications come. But this is the fundamental reason, this is why all this is happening. The basic problem is the glucose is not getting into the cells, it is getting stuck in the bloodstream. And this is the reason why. Why? So, because of this, then you have all, now what? Yeah.
Can you just shift that?
This one?
Yeah.
Sure. So now, all these complications happen. For example, now, most common complication is a kidney problem, because now you're putting excess load on the kidneys. They're having to get rid of all this glucose. So then it puts a load on the kidneys, the filtration mechanism, a very, very fine filtration mechanism gets clogged up, and you have kidney problems. And various other things which get into the act, which I don't want to go into. You all know this. I'm not here to tell you about this. I'm here to tell you how to get rid of all these problems. So the beautiful thing is, once you get rid of your diabetes, all these things also go away. You don't have to worry about these problems anymore. Right? So you go to a doctor. How do they diagnose diabetes? Is a typical thing. They say your fasting blood sugar should be 126, and then at any time you take it, it should be like 200. If there's any problem, you repeat it. But more than a blood glucose test is like a test of the amount of glucose in your blood at that point of time when that test was taken. So it is not it is like a temperature outside right now. It is not very indicative of the actual state. If you want to be actually specific, you need to take maybe a series of tests over a series of time and average it out and stuff like that. That's very complicated. So there is another test which I'm sure you heard of. It is called HbA1c. So this is a much more accurate indicator of the of your problems. What this measures is when the glucose level in your blood goes higher, it's not getting into the blood, into the cells. It starts attaching itself to the red blood cells. So Hb is hemoglobin. So what we are measuring this test is how much glucose molecules have got stuck to your red blood cells. So typically they say a reading of about 5. That's like if you have a reading of about 5, then you're like okay, you're not diabetic. And as it goes higher and higher and higher, it's a problem. And whenever you're taking any diabetes medication or whatever, the basic objective is to, how they, of course, they do the blood test and everything, but blood sugar test. But the important thing is, this is checked periodically to see if the medication has had the required effect, and if the HbA1c has actually gone down, and how much it has gone down. Or even 1% reduction from 7 to 6 or from 8 to 7, even 1% reduction in your HbA1c means a considerable reduction in your risk to diabetic complications. So there are two kinds of diabetes that everybody knows, type 1 and type 2, very, very briefly. So type 1 diabetes is what we call as insulin-dependent diabetes. Here, something has happened. See, basically we have an organ called the pancreas, as you know. The job of the pancreas is to produce insulin. And something happened to the pancreas, it's not producing insulin. Not producing enough or not producing at all. And therefore, there is no insulin. Or a very less amount. So the person has to take insulin supplements, injections from outside. There's no other way of it, and there is nothing you can do about it. In our talk, we are basically talking about diabetes type 2. However, the method they're suggesting also helps those with diabetes type 1. It cannot help them to completely get rid of their problem and get rid of it. They'll have to continue taking insulin, but what could happen is the dosage required to come down and the complications, etc., go away. So the approach we're suggesting helps people with diabetes type 1 also, but the primary goal is to work with people who have got diabetes type 2. So diabetes type 2 is where what happens is that the pancreas is making insulin. The insulin is getting into the bloodstream, but it is not able to get to the cell. So what the doctors call as insulin resistance. Now I'll get into that a little bit more detail. So what is basically happened is the same thing. The insulin goes into the blood. It is supposed to help the glucose to get into the cell, but it is not working. Therefore, the glucose remains in the blood cell and in the blood, and therefore you end up with diabetes. So why does this happen? Okay, the third type of diabetes is called gestational diabetes. This happens in basically pregnant women when they are pregnant. Their blood sugar levels, etc., they become as if they are diabetic. Once the childbirth happens, it may go back to normal. So, but the problem is it's a warning, it's a sign that something is not quite well. So it needs to be addressed. So this can also be handled with the same system we're talking about. Okay. So now what is the traditional treatment? So this we all know, I won't spend much time on it. So you go to if you have a diabetes problem, you go to a doctor, you send it to a dietitian, you give you a big food list, starch, fruit, milk, blah, 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 and say, you have to eat regular portions, you have to eat this only, this time, this quantity, you should not eat fruit, no bananas, no chickus, no mangoes, no sweets, no this, no that, and limited quantity, eat your food on time, all those things are there. And then in addition to that, they give you medication. So the medications, there are different types. So some type, what they do is they try to encourage the pancreas to make more insulin. Some types, they try to reduce the resistance of the insulin getting into the blood cell. Some types try to reduce the flow of the glucose into the bloodstream. So they work on all this. But finally, if all this doesn't work or is not good enough, the doctor says, sorry, we tried diet and we tried the medication, but it's not working. You need to get into insulin. And then you start off with one injection, so many units, and then 2 units, 3 units, multiple injections, 3-4 times a day, a huge number of units. And then there you are going on sticking yourself. So this is a traditional treatment, and unfortunately there is no other way out of it. But what result does it get? So the diet we have seen, if you follow the diet given by the diabetologists, it reduces your HbA1c by 0.5%. And the drugs, well, it's a loop, keep taking more and more until finally you become insulin dependent. So this is the way, and if you're a diabetic, this is the path for you, which everybody will show you, unfortunately. But now, what we are here to talk about is a new approach to diabetes. This system was actually developed as something which could prevent and reverse many diseases. But it was not scientifically proven. But just a few years ago, this gentleman called Dr. Neil Barnard, he is the MD or chairman of an organization called PCRM in the USA. It's the Physicians Committee for Responsible Medicine. So he actually did research. I mean, this was known earlier also by many people that this kind of a lifestyle what we're suggesting will help to reverse and cure many diseases. But he was the first guy who actually did actual research to see if patients with diabetes can be helped with this system. And he did it actually as per the medical parameters. He did a peer-reviewed case study. He had one group of patients who were following this, one control group, and they were monitored, and everything was done, and then it was published in a journal, and it was peer-reviewed, and so it passed through all the medical system. So what we are presenting here is the same work what Dr. Barnard has done in the US, and it has been medically, scientifically proven to work. Dr. Barnard has also written a book called Dr. Neil Barnard's Diabetes Reversal Program. If you go on Google it, you can easily find it, and you can even buy it if you like. And you can follow the book, and that's one way to go ahead. You can go ahead and reverse your diabetes by just reading the book and following what's written in it. So he's come up with this new approach to treating diabetes, and this is what we're going to talk about.